Fantastic. So hello and welcome to today's open event, where we'll be providing you with an overview of our exciting Health Professions Education MSc programme. Thanks so much for joining us. My name is Kate Thomas. I'm the Events Officer for the Faculty of Medical Sciences here at UCL and your chair this afternoon. We're hoping this session will address those course-specific questions you may have and will help you to gain an insight into what it is really like to study health professions education here at UCL. So this afternoon, our speaker, Catherine, will provide a summary of our exciting postgraduate programme, followed by a Q&A session with Catherine, Miranda and Lisa. So there'll be plenty of interactive opportunities for you all to join in throughout today's session. This session is being recorded and will be made available following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. Now to introduce our speakers, we have Catherine O'Keefe. Catherine is a Professor of Medical Education at UCL, where she leads the MSc in Health Professions Education and undertakes research in this field. She has a background in nursing with extensive experience of leading medical and health professions education, including previous leadership roles within HEE as an Associate Director of Education for a large NHS trust, and earlier in her career as a Director of International Education for a charity specialising in HIV/AIDS care. Catherine has a particular interest in the application of educational theory to leadership development within the healthcare settings. And Miranda Cromfley. Miranda is a lecturer on the programme and a module lead. She will also be here supporting the Q&A part of this event. And Lisa Andrews. Lisa looks after the operations side of the programme, so if you are interested in the course, you'll most likely hear from Lisa. She'll be joining us for the Q&A part of the event also. Thank you so much all. Before I hand over to our speakers, we would like to run a few polls for you to answer. Just launch those. So we'll give you a few moments to hopefully fill out those poll questions. We have 5 questions for you. You should hopefully see them on your screen now. So we are interested in where are you currently based? So whether that's overseas or in the UK. What's your health profession? So we've got a long list there, so if you are able to tick any of those, or equally if there's an other option, please do highlight the other. Where are you in your clinical career? So it'd be really helpful for us to know whether you're early career, mid-career, foundation, speciality, consultant, or other again. And what educational role do you have? So if you can let us know where you're currently at in terms of your role in your career, and what educational role would you like to have as well. So if you can just indicate those for us, that would be really helpful. I'll just give you a few moments. I can see we've got about 66% participated. Okay. Okay, I'll just share those results now. So have the results on your screen. So I can see actually we've got 50% in terms of 50-50 for some of you are currently overseas and some of you in the UK. That's great. And your health profession background. So we have 25% nurse, 25% dentist, and 50% other. If you're feeling brave, please feel free to put your obviously your profession in the chat as well. That would be really helpful to inform our speakers. Where are you in your clinical career? So we've got 50% are mid-career health professional, 25% are consultants, and 25% are other. So again, if you are feeling brave, please feel free to pop your obviously your clinical career experience in the chat as well. What educational role do you have? So we have 50% of you are health professions educator, clinically based, and 25% are lecturers, and then other at 25%. What educational role would you like to have? So we've got health professions educator, clinically based, 25%. Got a nice even split actually. So we've got a lecturer, higher education based at another 25% of you, and health medical educator with a policy organisation based at 25% as well. So that's really interesting. And then other again. So again, please feel free to pop any answers related to the other side of things in the chat. We'd love to hear from you. Okay, fantastic. I'll stop sharing that now. So hopefully, Catherine, that gives you a lot of insight into those joining us today. And now over to you.
Oh, lovely. Thank you very much indeed, Kate. And just to reiterate the warm welcome to this webinar and to your engagement with UCL. I'm fascinated by the poll results because they reflect a diversity of interest in the programme, which we see mirrored in the programme itself. We have we have multi-professional participants with a range of experiences and backgrounds, from early career professionals to much more experienced professionals from the whole host of health professions disciplines: doctors, nurses, physiotherapists, optometrists, audiologists, healthcare scientists. And this makes the programme a really vibrant initiative to take part in, because we help people understand health professions education within their own discipline, but also how one educates across a multidisciplinary team and how one educates interdisciplinarily, because this is increasingly important in the complex world of healthcare and healthcare education. I'm also really interested in the diversity of roles that you currently have, but your aspirations as well, from teaching clinically to working as lecturers in higher education, to policy organisations, and the intriguing other. So we might not find out in the webinar what the other is, but I'm sure it's really interesting as well. We've got a paramedic. Fabulous. That's great. Yes, I think we currently have a paramedic on the programme as well. So really, the diversity, I think, is incredibly interesting. The diversity of UK students and international students as well, so that we can understand what's happening within the UK and in other parts of the world. So before I say more, my colleagues contribute, I'd like to give you a brief overview of the programme. You'll be able to see this on the website that we have, but I think it's perhaps useful to get a sense of how the programme works. Firstly, I think the key thing to say about the programme is that we describe it as modular and flexible, so that if you choose that option, there are two main options: a modular and flexible, or a full-time option. But in both options, you can choose the order of the modules that you take. If you're doing it part-time on a modular flexible basis, you can fit that around much more easily around a busy work schedule and professional life, and you have up to 5 years to complete the programme. There is the option, if you would like, to do the programme 1 year full-time, which is doable but very intense. So the key design of this programme is around flexibility, and we also have lots of different options that you can take to progress in the programme. You can decide just to do a few modules so that you will complete a PG cert, which is where you need to get 60 credits made up of modules worth 15 or 30 credits. You can progress then on to a diploma, which is 120 credits, or you can aim to complete the full masters at 180 credits. And most of the modules are either 15 or 30 credits, with the final master's level module of a dissertation or report at 60 credits. But flexibility is key there. Equally, when you think about your future career aspirations, there are different options and routes to think about. The generic Masters in Health Professions Education, you mainly build yourself, looking at modules that you find particularly interesting, and perhaps taking a prerequisite module for either a dissertation or the report. We know people do have special interests. We have a pathway in primary healthcare, so that you can lead with a qualification in health professions education, brackets primary healthcare. And in this, you will need to choose from the list of modules that are core to that programme. We also have a research pathway, where the modules that you will need to take, there are several core modules which will focus on research, along with doing the master's level research or dissertation project. And also we have a very popular leadership module, which again has 4 core modules that you need to take, along with optional modules that you can choose, and you then progress and hopefully complete the dissertation or report from Masters in Health Professions Education brackets leadership. Very soon we will have a 4th option, where you'll be able to gain a specific qualification in assessment, and there will be specific core assessment modules that you can take. So that's the basic structure of the programme. There's a huge variety of modules that you can select from. There are some that people find particularly interesting, particularly early in the module, one of which is the Teaching and Learning in Health Professions Education, which introduces you to some of the key concepts about how we educate in the clinical area. But then we have a whole range of other modules that you might want to look at, such as curriculum development, if you're particularly interested in that, or one that we call Contemporary Issues in Health Professions Education, where we look at some of the complexities of working as an educator within particularly in the NHS, but also internationally as well. So I think I've done quite a bit of talking there, and that's a brief summary of the programme. There is more information on the website, and at the end there will be an opportunity to ask us questions. But one thing I must say, which I forgot to say, is that currently the programme is fully online, which was we made it fully online in response to the pandemic. We may be able to think about going back to a blended hybrid approach, which we had previously, but we don't have any news on that at the moment, but it is a possibility for the future. We have found with the fully online version that students find this really useful. It's very flexible. It's much easier to fit in with clinical and home life. But also the thing to say about our online version is that it's highly interactive. Modules have at least 2 synchronous days and synchronous catch-ups, where you use a platform such as Zoom, and we encourage you to feel confident to really take part, to get to know your peers and to interact with tutors and colleagues. So I think that's something to really think about if you're not sure about online, is that this is really highly interactive and enjoyable, and we find it very successful for learning. So Miranda or Lisa, is there anything that you would like to add in giving an overview of our programme?
Not really. I think the only thing I would build on what you've said, Catherine, is really to encourage people, if they're interested, to go and have a browse on the website at the different modules available, because it's the module descriptions that really give you a flavour of the course and what you might be able to get out of it.
Yes, and there's a wealth of information there if you want to have a look. Yes. Lisa, anything you would like to add?
No, I think, Catherine, I think you captured everything. Also, just with regards to applications for 22-23, they close on the 30th of June, so there's still plenty of time to apply. But also in case you do miss that deadline, we have a January intake for the programme as well. So that gives you more time in case you need that. We have 2 entry points in the year.
Okay, thank you, Lisa. So I think now the opportunity is for you to ask us some questions. So could I hand back to Kate to facilitate that?
Yes, thanks, Catherine, and thank you, Miranda and Lisa, for those inputs. Hopefully we've provided a good overview to you all about the programme, but equally, if you have any questions for us, we're here to answer those. Feel free to either pop your questions in the Q&A feature, or you can pop them in the chat. I think like Shane dropped a comment earlier, so feel free to either put them in either of those. We did have some questions submitted prior to the event, so we can start off with that, and then equally, if anyone wants to chip in or has a question about the question that we're addressing as well, please feel free to answer those. So one of the questions that we received was, what is the best part of this course? So Catherine, I don't know if you want to lead with that one.
That's a difficult one, because I think people enjoy, well, I think there's to enjoy all of the modules and comment positively on them all. But I think, as I mentioned, that students do find, as they start the programme, as they're building their confidence, the teaching and learning in health professions education, they find that module particularly useful to begin the programme, and that we run that module twice. But then we find that that's very much looking at the nuts and bolts of teaching and learning and developing people's confidence in that and education theories. But we find that once students master that, they then really enjoy progressing to other modules where we look in more depth at some of the complexity around education theory, for example, in some of our research modules that we do. And also we look at the complexity of how one goes about introducing educational change within the system in some of the leadership modules that we have there. So I think you find that as you progress through the programme, you begin to find other areas of real significant interest that you hadn't thought of initially when you're thinking about education, because most people think about how to teach and learn, but once you get into it, you realise there's a lot more to consider that's really energising as well as you progress.
Thanks, Catherine. I don't know if Lisa or Miranda, if you wanted to add anything to that question.
Yeah, just from student feedback as well, the students really enjoy how interactive the online programme is, and that seems to be something that, you know, the sessions are very interactive. There's lots of group work, and it's not just sitting at a screen and reading, you know, like the asynchronous events are really popular. And also through student feedback, we've actually introduced more online days and synchronous events. And I think students also like that if they're unable to attend them, they've got the recordings online, which means they can catch up, especially in light of, you know, the pandemic and the backlog from the pandemic. We found that our students are still very busy, and we do try to accommodate that for them and make their learning as easy as possible.
Yeah, I would say agree with Lisa, and from a tutor's perspective, the thing I enjoy most myself about the programme, my favourite thing about the programme is the discussions we have during our synchronous days with students. Which very much remind me of the discussions that we had in the classroom during my days when I was studying on a master's programme. And due to our small groups, we really do manage to create a space where we can pose challenging questions to students, hear about their experiences in their own health professions education practice, and how they can apply some of the things we discuss on the modules to that. And we really do get some fascinating discussions going. So that's a really, really fun part of the programme for me.
Thank you. And to lead on from that one, we do have another fantastic question. So this is particularly asking, what makes studying this course at UCL so unique from studying at other universities?
That's a really good question. Well, for me, I would say several things. Firstly, this particular programme is interprofessional, and that although you do see that elsewhere, I think it works incredibly well here. Students have a level of interest we have in the programme already within this webinar, people from different disciplines, but it's actually located within a medical school. So there's a strong body of support there for medical education, but actually now opening up and drawing on the perspectives and interest interprofessionally that makes it really dynamic. And from my own experience of joining UCL recently, I would say there's a really fantastic and dynamic research culture here, which feeds directly into the programme. We've recently won an award from ASME, the Association of Medical Education, in terms of our scholarship. And as some of you will be aware, that the Research Excellence framework exercise recently that we did incredibly well and came out top in the country. So I think that gives you a flavour of the sort of input that you will get from fellow students, interprofessional nature, from the teachers that we have on the programme, which is comprises of a core interprofessional team, but also the wider research team that feed into the programme as well. So it makes it very dynamic and up to date and forward thinking. But again, Lisa and Miranda, you may have some other thoughts on that.
I think I'm studying at UCL, and again, as a former MSc master's student at UCL myself, is a really, really fantastic experience for lots of reasons as an organisation. But I think the thing that really stands out for me is this particular programme, the team that we have involved in leading the programme, administering the programme, teaching the programme. Really brings a wealth of different backgrounds, experience and interests to the teaching on the programme. You know, we have faculty members from a range of different medical disciplines, allied health professions, you know, nursing. We have a really kind of diverse tutor team, and also with career experience and interest and research interests in lots of different areas, from kind of policy to sort of organisational kind of NHS management, to work outside the NHS, you know, abroad in healthcare in other countries, to research, you know, to kind of practical, hands-on, clinical teaching. So I think it's just the kind of the wealth of expertise and the breadth amongst the faculty team is really unique in our particular team, and I think makes for a great programme.
And I on second on that, it's just that the team are really passionate about the programme. It's fairly new as programmes go, and everybody's still passionate about it and has a drive, and I think that comes across in every aspect. And we really care about our students. We want our students to be happy, and we take on board their feedback. We take it really seriously, you know, through all our team meetings. You know, we have sections on the agenda, student feedback, and where and how we can make a difference to the programme to benefit students. So that's something else that I think is really important, you know, and a great aspect of the programme.
Fantastic, thanks very much all. Yeah, I think I can echo that. Working with the team as it is, you are all extremely passionate, wonderful people. So that's definitely true.
Thank you.
Okay, so the next question. So this is a question from perhaps a member of the audience. So I'm a dentist who wishes to have a part-time MSc in UCL so that they can work at the same time in London. They're from Greece, so mostly they need to know if this is possible, and if yes, how. And they said thank you in advance.
Well, thank you. It's a very good question. I think being a dentist is great. We'd love to have you on the programme. We have quite a few dentists on the programme who are really excellent in their contributions. Working in London is also fine, so we don't have a problem. The one thing that we would need to check out, though, is any visa requirements. Lisa, do you have any comments?
If you're working in London, I'm assuming that you've already got a visa that's allowing you to work, so that should be okay studying the programme, because we're actually online, so you wouldn't be coming face to face to study the programme. With regard to fees, It may be international fees, and this would be something that the admissions team would have to look into, but I'd be happy if you wanted to drop an email with some more details and we can look into that for you. But with regards to visas, I think if you're working here, it shouldn't be an issue for you to be studying, because it's an online program, which you would obviously be able to do around your work. But happy for you to email us after this, and we can look into your specific case in more detail.
Yeah. I think to say the vast majority of students are working full-time and studying this in their spare time. So it's hard work, but it's challenging and well worthwhile.
Fantastic. And so the next question is, do you have PhD opportunities for self-funded students in reproductive health? So I don't know if that's a question specifically we'll be able to answer for the course, but I think in terms of PhD opportunities, you can research that on our website actually. But I don't know if anyone
just
had
say
any advice.
In reproductive health, that we don't have that have reproductive health PhD opportunities within the postgraduate medical education department, but there may well be other parts of the Faculty of Medical Science that might. So I think the website is a good place to look at there.
Thanks, Catherine. And then the next question is, have the UCL MHP been traditionally delivered fully online? Are there any plans to transit to a blended learning approach / include campus sessions soon as we transit to a state of endemic? Perhaps in the 2023 intake is a question.
Well, I think originally that when the programme started, goodness knows how many years ago now, in the Institute of Education, and then we took it over and developed it as a revised programme. Originally it was face-to-face, and then we adopted a hybrid mode and a blended mode, so that we'd have some face-to-face and opportunities for students to also, if they couldn't make the face-to-face session, to join online. And then we would also have online learning activities in between. So with the pandemic, we took the decision to move it completely to online, and that has worked incredibly well. As I said, we could potentially move back to this more sort of hybrid blended model, but we're only just beginning to think about that now. So we can't really say when, but there would be a possibility in the future of that.
Fantastic, thanks, Catherine. And I can just see that we've had a question in Q&A. So this is from one of our audience members. So Vasilis, thank you very much for your question. So you are a dentist from Greece, and you'd like to do an MSc in a dental speciality, endodontology. Apologies if I said that incorrectly. As far as you're concerned, it is both clinical and theoretical course, meaning there is both face-to-face interaction with patients as well as online teaching, a combination which I find unique. The competition is really hard amongst contestants. Therefore, my question is about the criteria or qualifications of a contestant that would impress UCL and finally lead to the admission. They've just said thank you. Thank you, Vasilis.
Yes, thank you for the question. I think you would need to talk to the dental school about that, because this programme is specifically on health professions education, how we educate health professionals, the theory and practice of educating others, rather than a specific course on a clinical skill. So yes, I would encourage you to look on the website and contact the dental department, the Eastman Dental Centre, and I'm sure they will be able to answer that question for you.
Thanks, Catherine. And then our next question is, so I'm interested in the MHP research track and would like to find out more about the works of MHP alumnus. Could you showcase some of their work or let me know where I can find them? Thank you.
Okay, so In terms of this particular iteration of the programme, we do have graduates who've done quite a bit of research, or taken research into their work. We have a consultant hematologist who got a distinction in his research, and he's actually applying that in an interesting way by teaching back on the research programme there. We have graduates who are now, one who's just started a PhD in Dundee, an international student, a nurse who's looking at clinical teaching skills in her PhD, and others who are considering similar careers. So I think those two examples show that you can use your research experience either by following a research trajectory, studying for a PhD either here or elsewhere, but for practical reasons she chose a Dundee in that example. Or you can think about how you apply it to your career, developing a clinical career and maintaining an interest in education, and even actually also in research. We do have graduates who are interested in coming back and helping us with some of our research projects out of interest to further develop their career, not necessarily going on at this stage to do a PhD. So there's huge options there, but one of which is definitely going, if you do well, to go on to do a PhD here or elsewhere and develop a more traditional research career that way.
Fantastic, thank you, Catherine. I think those were all of our questions.
I think you have to talk to somebody. Sorry, I think there's a bit of a lag.
I think maybe we've lost you a bit, Miranda. Apologies.
Okay.
No problem. So yeah, I think hopefully we've provided you all with hopefully the answers to any questions you may have had, but equally I know that Catherine, Miranda and Lisa are very happy for you to contact them following today's event if you have any additional questions about our health professions education course. And yeah, we just wanted to say thank you so much for joining us today, and thank you so much to our speakers and for your questions as well. They were excellent. And we do have a very short survey for you to fill out following this event, so it should pop up in your browser. And yeah, we very much hope that you decide to study with us here at UCL. And yeah, I hope you have a lovely evening as well. So take care, everyone.
Thanks, everybody.
Yes, thank you very much indeed. Thank you. Good evening.